Okay, so this was the first weekend that capacity limits were lifted in many sectors, with further public health restrictions being loosened on March 1st. But what about schools? When will those measures be relaxed, and what impacts are the restrictions having on mental health of our kids? Well, those are questions on the mind of Dr. Dennis Diveletino, an assistant clinical professor in the Department of Family Medicine at McMaster University and a co-founder of Let Kids Be Kids. Dr. Diveletino, thank you so much for joining us this morning. So your request, your call to the government can be pretty much summed up by one line in the Pink Floyd song, Another Brick in the Wall. And that line is, leave the kids alone. Leave the kids alone. Okay, that is what you are calling on the government to do. So tell us why.
That's fantastic. I could not have put it better and more succinctly myself. And yeah, we are calling for a return to normalcy for our children. And we just think that it's an absolutely critical thing to do, and in fact is time dependent. And I believe Dr. Shagla was just on discussing the fact that we're actually seeing some reasonably positive things in terms of reopening. And most importantly, we just don't think that we have the data to justify continued disruption to our children, particularly in school. The data is simply showing that the school closures are not impacting COVID transmission in a meaningful way, nor have really lockdowns, but particularly our focus is on school closures. And other things like masks, I think we need to recognize are not benign interventions. Facial expression is critical in children's development and critical in the learning environment. So we've got to leave the kids alone, no question, so they get back to their proper social and emotional development.
Yeah, I hear that call loud and clear. Let's talk about the COVID-19 restrictions and the damage that you think has been done to children's mental health. I mean, just how bad do you think it is? Do we need to start making appointments for our 9-year-olds to go to therapy?
Well, I think what we're talking about is a community-wide issue. And I think like many situations like this that affect the whole community, it will affect certain groups more than others. And so I think as a medical community and as a society in general, we need to be on the lookout for children who have been disconnected and children who have serious mental health issues. And when it comes to other children who I think have simply experienced a disruption to learning and development, I think the exact opposite. If we can produce some normalcy here, we're looking for kids who bounce back so that we can get them on the right track. And when we provide the normalcy, if the children don't bounce back to their former selves, that's when we need to start thinking, okay, maybe something bigger is going on in this child. And that's when it's a very good idea to get a discussion going with your physician.
Right, and that's, Dr. Diveletino, that's a scary thing to think about, because you're basically saying there might be a lagging indicator for children's mental health when it comes to these COVID restrictions and what it's done to this generation of kids. I want to get back to what you said about the mask mandates. We know that kids, a lot of them younger than 4, can't get a vaccine, and the age group 5 to 11, a lot of parents are hesitant, you can understand, about giving their kids this vaccine. So we know that there's less protection in schools, and you know the government has said that mask mandates might be the last to go, but you think that they should be gone right now in schools so that kids can have their facial expressions and return to normalcy. Do you think that that benefit of no masks outweighs the risk of getting COVID in schools?
Well, the most important thing, I think, when it comes to the masks is that they have not been clearly protective in terms of COVID. I don't think that they change the overall transmission dynamics of COVID sufficiently to mandate it. The mask may provide some protection to the individual who chooses to wear it, but most importantly, a mask intuitively makes sense, but the evidence has to bear out that it works, and it doesn't. And so the most important thing is we cannot continue to be made to feel good by the sight of a masked child when the evidence says it's not helping from a COVID perspective. That's very important. Now, we
Yeah.
think the idea of taking the masks off the children last is perfectly backwards. The concept of filling the Air Canada Centre with maskless fans to cheer for the Leafs, don't get me wrong, I'm as big a Leaf fan as anyone. But that before taking the masks off our kids in schools, that's completely backward.
Okay. Dr. Dennis Diveletino, really appreciate your time this morning and your take. Appreciate it and take care. Thank you.